that way?
Exactly, sir. So we have many questions regarding the ADC prep and the first portion of the lecture. So we'll start with those questions. Once they're done, then you can start with the cosmetic portion.
Absolutely.
So our first question is about the masters itself. You mentioned that people can do masters. First question is, can we do masters in clinical subject on scholarship? And related to that is, if a person does masters from Australia, can they have a job based on that?
Do you want me to reply this in Urdu or English?
Whatever you feel comfortable with.
Okay. So what I would say, maybe I'll talk a bit in Urdu, is maybe easier for everyone. So पहली चीज आई वुड से कि सबको अंडरस्टैंड ये करनी बहुत जरूरी है कि स्कॉलरशिप्स इफ अगर आप clinical subject में देख रहे हो, that means dental related, and please correct me if that's the question or not. For example, बहुत से लोग कहते हैं कि मुझे पेरियो में रेजिडेंसी करनी है, मुझे प्रोस्टोडोंटिक में करनी है, ओरल सर्जरी में करनी है. Clinical subjects only available for citizens. So अगर आप citizen नहीं हो ऑस्ट्रेलिया में तो you can't get it. Secondly, there is a way जिसमें आप कोशिश कर सकते हो कि आप बोलते हो कि यार I really want to get into dental, but I want to do a clinical masters या clinical fellowship. उसमें दो चीजें हैं which you need to understand. एक चीज, you still need part 1 to enter that course. You still need ADC part 1 आपका पास होना चाहिए, उसके बगैर they don't let you enter the course. Secondly, for example, if I do a 3 years clinical masters in prosthodontic program, उसके बाद भी I cannot work as a specialist ऑस्ट्रेलिया के अंदर जब तक मैंने अपना पार्ट 2 पास नहीं कर लिया. So that is a very important clause. और यहाँ पर मुझे लगता है बहुत से लोग कंफ्यूज हो जाते हैं because उनको लगता है कि यार अगर मैं पैसे भर के या स्कॉलरशिप करके क्लिनिकल प्रोग्राम कर लूंगा तो आई डोंट हैव टू डू एडीसी. दैट्स द बिगेस्ट मिसकंसेप्शन बिकॉज एडीसी आपको फिर भी करना पड़ेगा. आप मास्टर्स करके करो या नॉन मास्टर्स करके करो, अगर आपने पार्ट 1 कर लिया है तो द चांसेस ऑफ यू गेटिंग स्कॉलरशिप मे बी 5-10% लेस. लेकिन अगर आपने पार्ट 1 भी नहीं किया हुआ और आप डायरेक्टली आना चाहते हो clinical masters के लिए, then you have to be a citizen. Simple as that. Does that answer the question?
Yes, sir. And the second one was the second one was if we're doing a master's, let's say in a non-clinical subject, can you do a job on the basis of that master's?
You definitely can do a job based on that master's. Example, if I do masters in occupational health and safety, I pick that masters और मैं कहता हूँ कि यार मुझे जब I finish that masters, I will apply for a job. If you do any masters in Australia, which is a 2 years masters, you get a 3 years work visa. Now, what a 3 years work visa is that you get 3 years work rights, full time living in Australia with full work rights to find work. Depends on the course you pick, depends how much in demand it is. And the way to check this is there's a PR list, which is permanent residency list. There's also a consolidated skilled occupation list. So there's skilled occupation list, which is your permanent residency list. You can Google it, you will find it. And there's consolidated skilled occupation list. So if you actually looked at a CSSOL list, which is a consolidated skilled occupation list, and SOL list, skilled occupation list Australia, if your master's or the course you're doing lies in that, that means that you getting a job is extremely high because there's a high demand of it. Now, if your master's does not come to that list, then the chances of you getting a job after that is less, or you might have to go in a very regional part of Australia and your chances of getting a job may be higher there, but there's no guarantee. because every 2 years, Australia changes their occupation skill list. And what happens is if I pick a occupational health and safety masters, by the time I finish, they might have removed it. So that is something which is very tricky for anyone to answer. But if you do a master's and once you finish, if you find a job, you can work in that, you can get permanent residency and all those things as well. Depends if your course stays in the skilled occupation list or not. That's simple as that.
Okay. And we have one more question related to masters. Would you recommend giving ADC while doing your masters in Australia, or can we give part 1, then enroll in masters, and then give part 2 while doing masters?
So I would personally say do the masters while doing ADC. But the way I will plan it is before you come to Australia, you've already done a lot of work or a lot of, I would say, study for your theory exam. Because once you come to Australia, the problem is you'll be working as well. You will be doing your masters as well. Then you will be studying for your ADC as well. It's like three things. And at the end of the day, I always tell everyone that you are a human. Think that way as well. So ideally, if you ask me, my preference would be coming to Australia, doing the ADC alongside your masters. But in the case that you already have worked 90% of your theory exam, which is a written exam, already before you move to Australia. If no, then that is a better option that you do your theory first because you don't need any exposure in Australia for that, then start the masters.
Okay, sir, thank you. Then we have a few questions regarding work experience and improving your dental portfolio. We have one question. I don't have any clinical experience after my house job. What do I do for the work history requirement of initial assessment? And related to that, I'll add one more question. Could you ask, sir, that will it be helpful to create a digital portfolio of your cases done during house job to help you secure a job after passing the licensing exam?
See, I always say this, and I will talk in my cosmetic dentistry lecture about this as well, that creating a digital portfolio or your social media presence or a digital profile always helps. Like there comes a point where you don't have to say to someone, my work is so good, because they can see it everywhere. So this is like a straight up. The first question of this part of this question was that I don't have experience in Australia. To do ADC, you don't need any experience. They judge if someone is 30 years experience with maxillofacial or orthodontic FCPS and everything, or you have no experience, they judge you with the same criteria, because this exam is based on someone who is their fresh graduate who is coming out of dental school. They're judging you based on that. So if you come out of dental school, you have no experience, even no house job, to do ADC, to pass ADC, there's no problem. But what happens is after you pass ADC, majority of us don't have permanent residency. And Australian laws keep changing. So if you have house job and at least 1 year of clinical experience after house job, which is 2 years, majority of the visas, once you pass ADC, they require 2 years of work experience for you to apply as a visa or permanent residency in Australia. So it doesn't help you in the beginning, but it helps you later. Because I know some dentists who actually had to go back to their country to get some experience, then come back. They passed ADC, but they didn't have enough experience to apply for their visa. If it makes sense. And second, again, if you have cases, if you have portfolio, even if you don't put it on your social media, when you apply for a job, along with your CV, if you have 10 cases or 5 cases, you could post with your CV. It puts a massive impact on the person hiring you. So it definitely helps. Any way out there, it definitely helps.
Okay, sir. Our next question is regarding the course material for ADC exam. Would you recommend some good academies, or what material people should use for preparing for the ADC exam?
So are we talking about part one or part two?
It's just a general question for both part one and part two.
So see, in my personal opinion, again, it's a very open opinion. I always say everyone is different. You know, even I know in dental school or in like when we were doing intermediate or O levels, people used to take tuitions. In my opinion, theory exam is a very not as straightforward, but all the information are already there. For theory, if someone doesn't want to take a course, you can do it without doing any course as well. However, if you want to, like these days, you'll notice with ADC, there's so many people. Anyone who passes ADC has their own course. So it's really hard for me to be out there and take a name out there. You can do some research. I would say anytime you pick a course, any course, part one, part two, make sure you can search that person who is teaching. Make sure they're the one who's teaching. It's not like they're just using their name and someone else is teaching on their behalf. Because you'll see that major problem is that if I say Dr. Mak Academy, but if I have two other people who are teaching the course, then you might not be getting me, you might be getting something else. So this is one point. Second is if you can see their work on maybe on their YouTube or their Facebook or Instagram about how they teach and their teaching methods, you might be able to connect with a mentor better. So you can make a decision on that, because for me, one person may be better, but for you, it might not be. So if I say pick this person, maybe for you, it's not very good. So just do some research. Part one, you can pass without it as well. Part two depends on your budget. And then if you want to do an online course or an on-site course, you basically can do a bit of a mix.
Okay, sir. We're halfway through the questions. I hope you're not tired.
No, I'm okay, yeah.
So our next question is, can you do or practice dentistry after your master's and get a PR?
So say that question again. Can
They
you?
ask, can you practice dentistry in Australia after your master's and get a PR?
So masters in what?
In any subject. It's a general question.
So like masters in a dental thing?
Yes.
So as I said, to my
Masters of Health.
Masters of Health.
Yes. Public
So
health.
again, it's masters in public health. So you can only work in public health. And so to work in Australia as a dentist, even you're a specialist or a general dentist, or even if you do a 3 years fellowship in Australia, you have to do ADC. There's no other. If you want to work as a dentist, then ADC you have to pass. If you're talking about that, if they did a public health masters and they can work in the health force in Australia doing public health, yes, they can, but not in dental, if it makes sense.
Yes, sir.
Yeah.
Up next, we have, is there any opportunity for students who haven't graduated yet and are in their final year of BDS for any observership or internship in Australia? And if so, how do we stand out in any undergraduate internship when applying?
So generally, what happens is in universities like Australia, America, and all those, they have transfer programs. And what happens is, for example, I'm in my third year of dental school or law school, or let's talk about dental school here in University of Michigan. And they say that, just for me to explore another country and their lifestyle and how their teaching style is, University of Michigan can transfer me into University of Melbourne for their third year, one semester. But to do that, your university standards have to be at the same accreditation with the university you're getting transferred. That means is America and UK are the only two areas where certain universities allow graduates to work in Australia directly without ADC. So if your question is that can I transfer or get internship or something like that, if your university guidelines don't meet that you can work without ADC, then no. The other thing can be observationship, kind of like that. That you can ask any dentist who's working in Australia. Like if someone's visiting and they can just do an observationship kind of like thing in their clinic or in their workplace for a month, that is very personal because that's private. But from an educational point of view, to get your credit points and university affiliation, basically you have to be at the same qualification. Otherwise, they won't allow it.
Okay, we have two more questions.
Yeah.
The first one is about the non-dental options that you mentioned. People are asking if you could explain a bit more about that.
So I would say I also have a detailed video on my YouTube, which masters to do. You can even watch that as well. But what I'm basically suggesting is if you say you don't want to do dental, then pick a course that is in the skilled occupation list. You can talk to my lawyer, and what lawyers do or the immigration agents do, some of them will just tell you whatever, but most of them, good ones, can guide you that this degree has been in the skilled occupation list from the past 8 years. And the way the demographic of Australia works, it's not going away for another 5 years or 10 years or 6 years predictably. You pick that course, which will basically guide you that if you're having that as your plan A, that gives you good chances of getting permanent residency and job. And that's what I say is these days, if you notice, majority of the masters are not in the skilled occupation list. The only one that is remaining there is masters in social work. But it really depends if someone really likes social work, because again, coming to my same thing is if you're not passionate about it and you just do it and then you end up in a trap, it might be a bit of an issue. The other non-clinical option, I would personally say, look into an MPhil and PhD option. Because MPhil PhD, what it's basically doing is it's giving you scholarships as well. I know so many people from Islamabad and Pakistan, Islamabad, Karachi, Peshawar, who have come on a 70 to 80% scholarship. All they did is they spent 3 to 4 months looking at a research topic, contacted the professors and applied for an MPhil leading to a PhD program. And you actually can earn while doing your PhD, just working in the universities and stuff. It gives you a guaranteed PR with PhD, and you have a very secure career. But if you don't want to do PhD MPhil, then look for a master's or a degree that is in the skilled occupation list that is a higher chance of staying there. So at least you have a bit of a surety for your future career in Australia.
Okay, sir, thank you. Our next question is, should we go on an immigration path or a study/work visa?
See, it really depends on your situation. It's really hard for me to say. Like, I know a lot of people who get married and they come on like a marriage visa, and then they can work full time. It's actually best for them that way, that they just look for an immigration route because they're already getting full working rights because of their husband or their wife or their partner. If you can't do that, then the only option you have remaining is basically study. So with the study visa, you can just look for, if your uh, plan A is ADC, you look for any cheap masters, whatever comes in your budget, which gives you guaranteed PR or not PR visa. And then you get 2 years masters minimum, and then you get 3 years work visa. So that means you get 5 years of doing your ADC exams, and hopefully you can work out your way during those 5 years. However, if you have immigration, because I know some people have family who can sponsor them, but it's very rare. If you can, then might be in your situation, but everyone's situation is very different. So it's really hard for me to say which one's going to work best for you, but both can work individually. It's all about you coming to Australia, whichever way you work.
Okay, sir. And our last question regarding ADC is, it's sort of these two questions are sort of the same genre. Can we do a non-clinical degree in Pakistan and is it recognized in Australia and then get a job on that basis while preparing for ADC? So, for example, if we do a master's in public health here in Pakistan, would that be recognized in Australia, number one, and would we be able to get a job on the basis of that?
So you'll notice that if you do a master's in public health in Pakistan or maybe from Dubai or Qatar, most of the areas you'll notice you can go to the same kind of like area. So from masters in public health from Pakistan, you can go to Dubai, you can go to Qatar, you can go to Saudi Arabia. It's going to help. It's not generally recognized in Australia. However, if you have already done masters in public health, you can look into applying for a PhD program, because someone who's applying for a bachelor's to a MPhil leading to PhD, their chances of getting scholarships, and for someone who's done a master's in public health, for them to get scholarship, it's a very high rate. So you might even get a 90% scholarship or a very high, rate of getting permanent residency and already a secure job. Because what they do with masters in public health is, if you actually find the right person and do some research on it, they will give you a package in a way that you will get your PhD program. As soon as you finish your PhD, you already have your PR and 5 years work contract ready for you. So I think that might be a bit better. But if someone says, like, if I can do just MPH in Pakistan and come to Australia work, basically you can't, unfortunately.
Okay, and a similar question to that, and the last one, I promise. Can American qualified dentists, DDs after an INVDE, move to Australia later on in their careers? And if yes, do we need to take ADC all over again?
See, that's the one. So if someone's from the USA want to come to Australia, what Australian dental or association have kind of like done for them is they can do dentistry for 2 years, but within 2 years, they have to pass the Part 2 exam. So they can work for 2 years, but within 2 years, they have to pass the Part 2 exam. If they can't pass the Part 2 exam within 2 years, then basically they have to leave Australia. The only two countries Australia allows it because they have a tie with UK, Ireland, and Canada. So if someone who has similar tie with University of Melbourne, and their thing is University James Cook University with I think Ontario, something. I think there's two universities in Canada. I don't exactly know. So from Canada, you can move. From UK and Ireland, you can move to Australia without doing ADC. But from US, you still need to do Part 2, but you at least get 2 years. I know a lot of people who just come here, work for 2 years, and then just go back to America.
Okay, sir. Thank you so much.
Another thing I wanted to ask, because I get a lot of this messages saying that a lot of our immigration agents tell us that you can't do dental hygiene application from Pakistan because you'll get rejected with your visa, because you've already done a bachelor's, you've done a higher bachelor's in terms of dentist. Now you're going for a lower like dental hygiene. So the way to do that is you come on a public health or any of the degree masters. In your first year, you basically sit with a lawyer and they change your course to dental hygiene. So there are a lot of ways that if I come to Australia on one degree, but I feel like I've made the wrong choice, during the first year or the first semester, you can change your master's or degree to another course. It allows you to do that. It's just very difficult while you're in Pakistan. So if a lot of people say, I maybe public health is not the best master's for me, but if it giving you better chances in terms of getting the visa, then you can do that. But once you come to Australia, you can always change your degree as well. So there's no like hard and fast rule that you can't change.
Okay, and so we've received so many questions regarding dental hygiene. As soon as you mentioned that path, I'm just going to take one more.
Yeah, absolutely.
Do we have to pass a test for dental hygienist, or does dental hygiene require ADC exam?
No, so there's a dentist board and there's a dental hygiene board, and I'll just go back to, if I can. I actually did mention it here. There. So there's a general dentist exam is separate, and there's a dental hygiene exam is completely separate. If you're a dental hygienist with at least 2 years degree equivalent or a 3 years degree, then you can apply for a dental hygiene exam, which is not an ADC for dentists, is for dental hygienists, and you can do it if someone is already a dental hygienist. However, if you're not a dental hygienist, but if you want to do it, basically you just do a 2 years or a 3 years bachelor's. But the thing with dental hygiene is you can earn like a great amount of money. It's a less stressful job. It guarantees you a permanent residency, and you're still in the dental force. And just giving everyone an example, if a average dentist in Australia is earning somewhere between $80,000 to $200,000, the dental hygienist is actually earning $80,000 to $100,000, which is very close to what an initial start salary of a dentist is. So dental hygiene still have great careers. You can have a great lifestyle and everything. And it's the one thing that guarantees you a permanent residency, because every clinic needs a hygienist. And that's why when people ask me what's my preferred course, if I have to go back and I just go back in 2015 now, and I feel like now I have to pick a course if I want to move to Australia, I will come to Australia on a master's in public health because it's easiest to get visa, and then I'll come here and change it to a dental hygiene. It's a 3 years. I'm part of the dental industry. I'm seeing patients, and that way I'm not like really stressed on my dental journey, my Australian journey. And in the future, anytime I pass ADC, I can work as a dentist. Even if I don't pass ADC, I'm still in the dental industry. I'm still working really well, because I feel our concept of dental hygiene is only cleaning. In Australia, there's oral health therapist as well. I'm not sure a lot of people are aware of it or not. OHT. OHTs are similar to hygienist, which is the same kind of like degree, allows you to do dental fillings as well, allows you to do whitening treatments as well, allows you to do some minor composite and cosmetic bonding as well. So when you're in OHTs and hygienists, it's a massive difference. So you're still like doing hands-on good clinical procedures on patients. And basically, I feel like it's a much better pathway than doing masters in public health. Completely different. You don't know if you're going to get a job or not. I think there's no voice.
Thank you so much, sir, for such an in-depth explanation of all the questions. I'm sure all the queries have been answered. With that, we end our session with you. We appreciate you for taking out time for us. And thank you so much for inspiring us. I'm sure everyone is truly mesmerized. So we hope you had a very good experience with APDSA Pakistan, and we hope that we can work in the future as well.
My
Thank
pleasure.
you.
Allah Hafiz, and God bless you, all of you. Okay. Allah.
That's it. Thank you.
Take care.
Your lips are still glowing.